Imagine a situation where someone's airway is blocked, preventing them from breathing. It's a life-threatening emergency. That's where devices like the iGel and the classic LMA come in. These airway management tools are crucial in hospitals and emergency situations. The iGel and the classic LMA are like superheroes for our airways. They help patients breathe when they can't do it on their own. These devices are used by doctors and nurses to secure an open airway during anesthesia or in critical care. Understanding their differences helps medical professionals choose the best tool for each patient. This ensures the best possible outcome during critical moments. Both the iGel and the classic LMA are effective at managing airways. They create a seal in the throat, allowing air to flow to the lungs. Studies show that both devices have high success rates in establishing a secure airway. However, there are subtle differences. The iGel has a gel-like cuff that conforms to the patient's anatomy. This often leads to a tighter seal, potentially reducing the risk of air leaks. The classic LMA, while also effective, might require more careful placement for an optimal seal. When it comes to safety, both devices have good track records. Complications are rare, but like any medical procedure, risks exist. These can include airway trauma or dislodgement of the device. For medical professionals, ease of use is important, especially in emergencies. The iGel is designed for quick and easy insertion. Its anatomical shape helps guide it into the correct position. This can be especially beneficial in high-pressure situations. The classic LMA requires more finesse to insert correctly. It involves inflating a cuff to create a seal, which might take a bit longer than the iGel's self-sealing mechanism. However, with proper training, both devices can be used effectively. Many hospitals and emergency medical services use both devices. The choice often comes down to the specific situation and the clinician's experience. So, which device emerges as the winner? It's not about one being definitively better than the other. It's about choosing the right tool for the job. The iGel, with its ease of use and often superior seal, might be preferred in emergencies or situations requiring rapid airway control. The classic LMA, a reliable and well-established device, remains a valuable option for various clinical scenarios. Ultimately, the best choice depends on the patient's specific needs and the clinical judgment of the healthcare provider. Both the iGel and the classic LMA play vital roles in airway management, helping to save lives every day.